Hi everyone, I'm Dr. Jide. Most people think you need to go to hospital for every minor surgical procedure. But what many patients don't realize is that GP practices, community clinics, and primary care networks now offer a wide range of small surgeries and procedures, often faster, closer to home, and with shorter waiting times. Today, I'll walk you through the most common procedures done in the community and how you can access them safely. What are minor surgeries in primary care? Minor surgeries are quick, low-risk procedures that don't require a hospital theater. They are done in GP practices or community hubs with the same professional standards, equipment, and safety processes. These treatments are ideal for conditions that are small, superficial, easily managed under local anesthetic, and unlikely to need hospital level facilities. And the benefit is that patients get care closer to home, often without the longer hospital waiting times. Different GP practices offer different services depending on their clinicians' training. But here are the most common procedures available across the UK. Joint injections for shoulder pain, knee arthritis, tennis elbow, or trigger finger. You could have skin lesion removal for warts, cysts, small lipomas, benign moles, depending on your local policy. You could also have cryotherapy, a procedure for freezing warts, verruca, some precancerous skin changes. You could also have incision and drainage for small abscesses or infected cysts. And there are ring pessary fitting for pelvic organic prolapse. The ones commonly done by trained GPs or nurses are toenail procedures for ingrown toenails, contraceptive procedures for implant insertion or removal, coil or IUD or IUS fitting, and ear microsuction. These are mostly available in many NHS community clinics. These services reduce pressure on hospitals and speed up access to care. Primary care networks and community hospitals also provide dermatology clinics for rashes, acne, lesions, and biopsies. They could also provide musculoskeletal clinics, first contact practitioners for specialist joint assessments and injections. There are sexual health clinics for contraception, screening, and treatment. And you have minor ops staffed by GPs with extended roles and specialist nurses. These clinics offer hospital level expertise without the hospital waiting time. This is the part patients often find confusing. So let me make it simple. The first step is you need to book a GP appointment. Your GP or nurse assesses the problem and decides if the procedure is appropriate, if it is safe to do in general practice, or if it needs referral. Step 2. GP checks local commissioning policies. In England, the Integrated Care Board, that is the ICB, decide which minor surgeries are funded in primary care. Step 3. The GP refers you to the right place, and the options can be your GP practice if they do minor surgery, a community clinic, a GP with extended role service, or a hospital outpatient clinic. And step 4 is you receive an appointment date, often sooner than hospital surgery list. The key is you can't self-refer. You must be assessed first. Even though these surgeries aren't in the hospital, they follow strict governance standards. You should expect clear explanation of what will happen, consent process, a sterile environment, safety checked equipment, a trained clinician with the right accreditation, and aftercare instructions. As regards governance, I can assure you that community surgeries undergo the same audits and safety checks as hospital procedures. Before your procedure, remember, bring your medication list. Tell the clinician about blood thinners if you take them. Ask how long recovery takes. Check whether you should avoid exercise after. Ask when to seek urgent help afterward. Simple steps make the procedure smoother and safer. Many procedures that used to require hospital visits are now done safely in the community, quicker, closer, and just as effective. If you think you might need a minor procedure, start by speaking to your GP. I am Dr. Jide, helping you understand healthcare one conversation at a time. If this episode helped you, please like, share, and subscribe. Don't forget to subscribe for the next episode where we'll explore how to make the most of your specialist appointment. Bye.